Welcome to this virtual clinical experience session, and thanks for joining us. Today we've got 8 participant students with us. We've also got some observers. If you've not been in one of these clinical experience sessions before, please do join in on the chat. I'm going to be giving you lots of opportunities to write down questions and answers and comments that you can chat amongst yourselves. There's also going to be opportunities for you to pose questions to me through the Ask the Clinician button that you can use there as well. Really important bits, make sure you're in a private space, make sure that you're aware that this is a professional environment. There's going to be a real patient in with us very shortly. So code of conduct that you've already read through is really important to understand and adhere to. Throughout this session we want you to have your camera on at all times. Myself and the patient will be able to see you on our screen. If your camera goes off, we will remove you from the session. If you need to pause for any reason and step out of the room, then use the pause button and it'll pause that transmission for you.
Hi there, Miss Braithwaite.
Yeah, sure.
Come on in.
Sorry.
Come on in, have a seat for me. Would you be able to talk to me a bit about what the problem's been?
Yeah, well, I've had this bad shoulder. It started about 3 or 4 months ago, and well, it's got worse, and so it's yes. I went to the doctor with it, and he said go send me here.
Yeah.
That's it,
Yeah. Tell me a bit about it. What's the trouble?
Well, it started about, like I'm saying, about 3 or 4 months ago. It's just a bit of a mild dull ache there. But then the past 6 weeks, it's got really bad. Yeah, okay. So it's affecting everything really. It's certainly work. And,
okay.
It's getting, it's obviously bugging me. So I want it sorted. Really.
Sorted. Yeah, absolutely. Mm-hmm. So the next thing we really need to do is have a look at your shoulders, sure, and see what's going on.
Yeah.
I'm just going to give some instructions to the students, if that's all right, just to get them thinking while we're doing the examination part as well. I'm going to ask our students where we're up to and see if they've got any extra questions for you, which I'm sure they will. Sure. We've got a few other things I want to figure out.
Okay.
So this is kind of back to the students now. I'm going to start, if you can add some extra questions in the chat to me, and I'll put them to John and see what there is. So one of the students has asked, are you left-handed or right-handed?
Right-handed.
Right, so this is your dominant hand, this is the one you're using for work. Yeah, absolutely.
Some of these tests and movements that we're going to do can be uncomfortable at times, and that helps us figure out what's going on inside your shoulder.
I've got you.
All right. So just going to look at your shoulder from straight on. Mm-hmm. What I'm looking for is any deformity, any muscle wasting. All right. Mm-hmm. I'm looking from the side. Can I just roll this up?
Yeah, okay? Yeah, of course.
Super.
And shoulder from the side here. That's great. You've not had any operations on here before, have you?
No.
Fine. Okay. I'm just going to have a little look around the back as well, if that's all right. I'm just going to have a feel along the edge of the scapula there. Fine. Okay. Does anyone want to jump in and come up with any suggestions of differential diagnoses for the pain that John's getting in his shoulder?
Could it be a rotator cuff injury?
So it certainly could be an injury. I think when we were talking about the history, you're not aware of any injury that happened, but it's certainly something that we need to consider. Any other thoughts? Any other potential causes?
Maybe osteoarthritis?
Yeah, so osteoarthritis, it's kind of long-term degenerative damage to the joint, although it's only been in one joint, but we did do some more investigating to figure that out. Any other suggestions?
Maybe a shoulder impingement?
Yeah, absolutely. So one of our students has suggested what I think is going on, which is called an impingement. That's where there's a narrowing in the shoulder joint at stop.
So thanks everyone, thanks for your participation in that session as well. I thought that was a really interesting presentation and interesting case. There were some good clinical findings there that we found on examination as well. So now that we've completed the session with the live patients, a really important part is for you to think about what we've been talking about, the topics that have come up and your learning points going into this session. When you leave this debrief, there's an opportunity for you to write your reflections on the learning process today, what you've got out of it, and what you're going to take forwards and remember.